Do you know what ascites is and how it affects your body? Ascites is a medical condition characterized by an abnormal accumulation of fluid within the abdominal cavity. The most common cause of this condition is liver disease, such as cirrhosis. But why does this happen? Well, when the liver is impaired, it leads to fluid retention and increased pressure in the veins. This pressure forces fluid to leak into the abdominal cavity, causing swelling and discomfort. But liver disease isn't the only culprit. Other conditions such as heart failure, certain cancers, kidney disease and infections can also lead to ascites. In essence, any condition that disrupts the body's fluid balance can potentially cause ascites. It's not a condition to be taken lightly, as it can cause serious discomfort and health complications. Now that we know what ascites is, let's dive deeper into the various medical conditions that can lead to ascites. There are various medical conditions that can cause ascites. One of the most common is liver cirrhosis. This chronic liver disease often stems from excessive alcohol consumption, viral hepatitis like hepatitis B or C, fatty liver disease or other liver conditions. The liver is a vital organ responsible for detoxifying harmful substances, producing proteins that help blood to clot, and creating bile to help with digestion. When the liver is scarred, it disrupts these functions, leading to fluid accumulation in the abdomen, a condition we know as ascites. Now let's move on to another condition that can lead to ascites: heart failure. The heart, as you know, is responsible for pumping blood throughout our body. When the heart fails to pump blood effectively, it causes fluid to accumulate in different parts of the body. This condition is known as fluid retention. Most commonly, we see fluid retention in the legs, a condition known as peripheral edema. But fluid can also accumulate in the lungs, causing pulmonary edema. And yes, you guessed it, fluid can also build up in the abdominal cavity, leading to ascites. Both liver cirrhosis and heart failure disrupt the body's normal fluid balance, causing fluid to overflow into the abdominal cavity. But it's not just the fluid that's a problem. This buildup increases pressure in the veins around the liver and in the abdominal cavity, causing discomfort and other complications. But liver cirrhosis and heart failure aren't the only causes. There are more conditions that can lead to ascites. In the next part, we'll delve into some of these other conditions, including certain types of cancer, kidney disease, and even specific infections. Each of these conditions disrupts the body's normal fluid balance in unique ways, contributing to the development of ascites. So, stay tuned as we continue our deep dive into the causes of this complex medical condition. In addition to liver cirrhosis and heart failure, cancer and kidney disease can also lead to ascites. Let's dive into the details. Certain types of cancer have the potential to cause ascites. This includes liver cancer, ovarian cancer, pancreatic cancer, and even cancer that has spread to the abdominal cavity, known as peritoneal carcinomatosis. These cancers interfere with the body's normal fluid balance, leading to fluid accumulation in the abdomen. The disruption is often due to the production of a protein by the cancer cells that makes the small blood vessels in the abdomen leaky. When the vessels become permeable, fluid escapes into the abdomen, causing ascites. Now, let's turn our attention to kidney disease. Kidney conditions such as nephrotic syndrome or advanced kidney failure can also lead to ascites. The kidneys play a crucial role in managing the body's fluid balance. When the kidneys are impaired, they can't efficiently remove excess fluid from the body. This leads to fluid retention, not just in the abdomen, but throughout the body. In the case of nephrotic syndrome, the kidneys leak large amounts of protein into the urine. Since proteins help keep fluid in the blood vessels, the loss of protein leads to fluid leaking into body tissues and spaces, including the abdominal cavity. It's clear that the body's delicate balance of fluid is easily disrupted by various medical conditions. From the liver's role in producing proteins and processing blood, the heart's pumping power, the role of cancer in affecting blood vessels, to the kidney's crucial function in managing fluid and protein balance. Any disruption can lead to fluid accumulation in the abdomen, otherwise known as ascites. And still, there are more conditions that can cause ascites. So, stick around as we continue to unravel the complexities of this medical condition in our next segment. We've covered some major conditions that can lead to ascites, but there are still others. Infections, for instance, like tuberculosis or peritonitis, can trigger inflammation and fluid accumulation in the abdomen, leading to ascites. Similarly, pancreatitis, an inflammation of the pancreas, can sometimes result in ascites, particularly in severe cases where there's significant abdominal inflammation and fluid leakage. Malnutrition also plays a role. Severe protein deficiency, often seen in conditions such as kwashiorkor or severe malabsorption syndromes, can lead to low levels of protein in the blood, resulting in fluid accumulation in the abdomen. Lastly, autoimmune diseases such as systemic lupus erythematosus or rheumatoid arthritis can sometimes cause ascites due to inflammation and immune system dysfunction affecting various organs, including the liver and kidneys. As you can see, ascites can be caused by a variety of conditions. Now let's talk about its treatment. Treatment for ascites typically involves addressing the underlying cause. This might mean managing a liver disease, heart failure, certain cancers, kidney disease, or an infection. Symptomatic relief often includes restricting dietary sodium intake. This helps to reduce fluid accumulation in the body. Alongside this, doctors often prescribe diuretics. These medications assist the body in expelling excess fluid, reducing the pressure and discomfort in the abdominal cavity. In severe cases, a procedure called paracentesis comes into play. This involves the careful removal of fluid from the abdomen using a needle and can provide immediate relief from symptoms. However, it's important to note that this procedure treats the symptom, not the cause, and the fluid may reaccumulate if the underlying condition is not managed. Understanding ascites, its causes, and treatment options is crucial for healthcare professionals, patients, and their families. Knowledge is the first step towards effective management of this condition.